Dr. Cameron, talking about children, and it's very important to get an early routine established, I'm assuming, that will last them a lifetime. How do we get that established without nagging them to death and them turning them off the other way, you know?
Well, I don't know that you're ever going to be able to completely get rid of the nagging, okay? But there are some things that definitely help with children. So I recommend people start before they have any teeth. They've got these little brushes. It's like a silicone that goes over your finger.
Yes,
it's very soft.
Yep.
Before they have teeth, just introduce. I mean, they're used to sucking on a bottle or eating, right? So they're used to things in there.
Yeah.
But you want to introduce something that's going back like you will with a toothbrush. So get that on your finger and just scrub their gums.
Okay.
Just get them used to it so that they know what it is. And I find I've done this with my own kids. I can't say it works for everybody, but I give this suggestion a lot, and parents seem to say that it works. Find a song, okay? I think the ABCs is a great one.
Okay.
It's got a certain length, and you can go through it twice, maybe once on the bottom, once on the top.
Okay.
So they learn that that's how long it's going to be, and they expect it.
That's a good
So
idea.
instead of, it feels like forever and you've been in there for like 2 seconds,
Yeah.
right? But that way they get used to it, and I've developed a routine with my kids. They've just got some songs that work for them. Some parents have, as kids get older, they've used a YouTube video that they watch. I mean, there are actually some dental websites from the American Dental Association that have videos that are all 2 minutes long.
Oh, really?
For kids to watch while they brush. So, but it starts at a very young age,
Right.
preventing the fight by getting them used to the fact that you're going in there. And do the same thing once they start getting some teeth. Get a very soft and a small brush.
Yeah.
Don't get an adult-sized brush and try to stick it in a 2-year-old's mouth, right?
Right.
Because you're going to gag them
Yeah.
way fast, and that's an immediate turn-off for
Right.
anybody if they get gagged.
Right.
So start early. Find something like a song. You don't have to be a professional singer. I'm not. Okay, but your kids will love to hear your voice anyway. That's
Yeah.
a whole different story. But that way they expect how long it's going to be.
Okay.
Because even us as adults, if we actually timed ourselves, we may think it was 2 minutes. It's usually more like 45 seconds.
Really?
That's what studies have shown. So
That's scary.
if you have a song or something like that, or a story that's a definite time that they expect, you'll find it goes a lot more smoothly with most kids. Not that some aren't going to fight you tooth and nail anyway,
Right.
but that's a great way to start it.
Right. What's the next step then? We've got them started on the path when they're very young. I suppose, is it getting them established coming into the dentist office too?
Yeah, and it's also getting them to start on flossing. Okay, now a lot of parents may find this hard because they don't floss themselves. Okay, we don't meet a lot of super flossers around here, but getting them the little flossers that kids can use. They're not having to tie it around their fingers. They're just little floss picks. Most people have seen those at this point.
Yeah.
And they've got some fun kid ones that maybe Toy Story or Dragons or Dinosaurs. It's something fun for them. They can hold on to. As soon as they start getting their back teeth that touch, they need to be flossing. Any tooth that touches another tooth needs to be flossed.
Okay.
And so building that into their routine, then you know once they're brushing themselves, you can get on those little toy timers, the little sand timers.
Right.
You can use a YouTube video if that's your thing, but something that has a set time that they also can watch
Okay.
and know that, okay, now I need to switch. You know, ideally spend a minute on the bottom, spend a minute on the top.
So you're saying that 2 minutes is the optimal time. Is that top and bottom included?
2 minutes twice a day. That's the big thing. Is if you brush your teeth for 2 minutes twice a day, you're gonna, along with flossing,
Right.
you're gonna reduce your risk of cavities quite a bit.
Really? So you're saying that you're never too young to start brushing, and you're certainly never too young to start flossing.
No, and you're never too old to start flossing either. By
This
the
is
way.
true. You're never too old to start, or brushing for that matter.
So yeah, as soon as teeth are touching, they should be flossed because a toothbrush cannot get in between teeth that are touching.
Okay.
So you really want to start that. We can all do better at that. But you introduce those routines where kids know that's just part of good care,
Okay.
and that'll start them off on the right foot, so they hopefully have fewer needs when they come see the dentist,
Right.
and a better overall experience.
Okay. But obviously, the most important thing is to get that routine established of early visits to the dentist, doing the gum massaging and scrubbing, and then the teeth brushing and the flossing, and by the time they're teenagers, hopefully they'll be thanking us.
Yeah, absolutely. Well, and they will. If we occasionally see someone that's never had a cavity and they come to Utah State for college, they're not from here,
Right.
they've never had a single cavity.
Wow.
And it's great.
Yeah.
You know, we love to see it. So, yeah, the earlier you start, the better. And teaching them good habits and also setting a good example.
Right.
You know, like anything else with parenting, they should see you brushing and flossing as well.
Yeah. And they do. They love to stand at the side of you, don't they, while you're brushing your teeth and brush theirs. So, yeah, get that early established routine going. And any questions, come in and see Dr. Cameron here at Aspen Dental, and I'm sure he'll help you out. Thank you, Dr. Cameron.
You're welcome.